we know that Maze is the most efficacious procedure to treat atrial fibrillation, and it was developed by Jim Cox in the US, and it is a rather heavy operation from the surgical standpoint, because it takes a long time. You have to make lots of incisions. You cut the tissue from the left atrium, from the right atrium, and after cutting you resuture. But in the paper there's what's called the modified Maze. Instead of cutting and sewing, they just use cryo along the same lines, using the same lines as more or less the same lines as those described by Cox. And so the great advantage is that you improve safety without decreasing much the efficacy, because cryo does almost as good as the scissors, because it destroys the cells at the level where the probe is applied by the temperature, very low temperature, or radio frequency, which burn with high temperature. So cryo is very low temperature, radio frequency very high temperature. The objective is the same, is to destroy the cells and to create a block, a line which is a block that avoids the conduction, the electricity going in circles inside the left atrium. So the advantage of the modified Maze is that it decreases the invasiveness of the procedure, is quicker, and it's safer because it has less complications. There's preliminary information that we got this morning, and that requires to be confirmed by the further analysis, complete analysis of the full paper, of course. But from what we heard this morning, it is interesting, because in terms of it decreases the rate of atrial fibrillation patients at 12 months, and it is safe. It does not increase the complication rate perioperatively. So it's quite interesting, because it shows that you can use it without increasing the risks of the procedure itself.